Welcome to Empowered. I'm Elizabeth Naumovski. Have you heard of the Low-FODMAP diet? This is a specific diet that you need to monitor, and you need to speak to a dietitian because there's only a limited amount of time that you can be on it. No one wants to talk about gastro issues, but we will tonight. If you're experiencing food intolerances, if you have IBS, diverticulitis, or anything gastro associated, this show is for you. I'm joined by Alexandra Anca, registered dietitian and founder of Alexandra Anca Nutrition Consulting, specializing in gastrointestinal disorders for the past 18 years. She holds a certificate on the low-FODMAP diet from Monash University in Australia. Alexandra was most recently awarded the King's Coronation Medal for her work with Celiac Canada in raising awareness about celiac disease. Today's topic is the low-FODMAP diet and what we need to know. Hello, Alexandra. Thank you so much for being here today.
Hi, so good to be here, Elizabeth. Thank you for having me.
Okay, so let's just jump in. What is the low-FODMAP diet?
The low-FODMAP diet is a short-term elimination and reintroduction protocol that helps us determine the food triggers that are responsible for symptoms that are commonly experienced by individuals with irritable bowel syndrome, things like bloating, diarrhea, cramping, a lot of gas, things that tend to be very bothersome and affect the quality of life.
So when you're on the low-FODMAP diet, what foods need to be avoided?
So the low FODMAP diet tends to limit or avoid carbohydrate-rich foods because they contain something called quick fermenting sugars that tend to pull in a lot of water, create a lot of gas in the intestinal system, and cause those symptoms that I just spoke about. So we are looking at foods that are essentially carbohydrate rich. So if we start at the top with a grain product or grains group, we avoid things like wheat, barley, and rye. We avoid a lot of the legumes, except for a short or a small amount of chickpeas and lentils. We avoid lactose containing dairy products. Lactose is a fermentable, quick fermenting carbohydrate, as well as a large array of fruits and vegetables. For example, with fruit, we tend to avoid stone fruits like peaches and apricots, apples and pears. These are fruits that are very, very common in the Western diet. And on the vegetable side, major group of the Allison family: garlic, onions, cruciferous vegetables like broccoli and cauliflower. Those are the types of foods that tend to, again, exacerbate or make symptoms of bloating and gas quite bothersome for individuals.
So you've talked about many of the foods that we need to avoid. What can we have instead then?
Well, as funny it is that as long as it's the list of these foods to be avoided as it is, the low FODMAP alternatives are actually quite varied. So when we talk about, again, if I am to use the same order in which I talked about the other foods, so in the grains we have oats and quinoa, rice and corn, so quite a bit of variety. When we talk about fruits and vegetables, we have in the fruits group cantaloupes, honeydew, hammy melon, or we have tropical fruits like papaya, pineapple, and kiwi. We have grapes, for example, blueberries, raspberries. A lot of the berries, with the exception of blackberries, those are actually high FODMAP. So there's quite a bit of variety. And when it comes to vegetables, we have a lot of the dark leafy greens like spinach and kale, Swiss chard. We have root vegetables that are low FODMAP. We have winter squashes, as well as salads. So we can have lettuce, tomatoes, cucumbers, and peppers. Those are all low FODMAP choices. But you need to have this diet monitored by a dietitian who is trained in the low FODMAP diet to make sure that you don't unnecessarily avoid food for that duration of the elimination phase.
So why, if somebody's on the low FODMAP diet without a dietitian, clearly they're going to be on it a little bit too long,
Right.
probably not on it properly. I want to really delve into this when we come back from the commercial break as to why you need a dietitian and whether it could be harmful to you for being on the low FODMAP diet for longer than you should be, because I believe that there's a specific time frame. So please don't go away. We'll be right back and discuss more about the low FODMAP diet. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's episode, we're discussing the low FODMAP diet, what you really need to know. Before we went to break, Alexandra, we were talking about the fact that not everybody should be on this low FODMAP diet. You need a dietitian and you need to be on a specific time frame for it. Why do you need to be, on it for X amount of weeks or whatever it is? And what does it do to you if you're on it too long?
So it's because the diets avoid a lot of food, as I mentioned before, the list of high FODMAP foods to be avoided for that elimination phase is quite extensive. Two things can happen. Number one, you run the risk of developing nutritional deficiencies. And so it's very important to be able to keep in mind, the vitamins and minerals that you're taking in from various foods and to make sure that the low FODMAP diet compensates for that. The amount of fiber, again, when you look at the high FODMAP foods, they actually tend to have quite a bit of fiber. The low FODMAP alternatives don't have the same amount of fiber, nor the same kind. And fiber is very important for the diversity and the health of the gut microbiome. And if you miss out on those types of healthy fiber that can be found in the low FODMAP diet, you may be able to exacerbate it and not recover as quickly. And of course, the biggest issue is probably weight loss. The low FODMAP diet is not a weight loss diet, but weight loss can be experienced by some individuals because they are not comfortable with the low FODMAP options.
So who should be initiating the low FODMAP diet then?
So typically, it's very important to be speaking to a gastroenterologist, a doctor, and to have a formal diagnosis of either irritable bowel syndrome or what we know as SIBO, small intestinal bacterial overgrowth. And for individuals who have been diagnosed with these conditions, a low FODMAP diet tends to be 85% effective or effective in 85% of those individuals. So it's an extremely effective diet at helping with symptoms. Anything other than that or outside the realm of SIBO and IBS tends to be something that needs to be fully investigated. And so the low FODMAP diet should not be initiated prior to proper diagnosis.
So then who should not be following the low FODMAP diet?
Right. Extremely important for individuals who are underweight or of low weight to not start the low FODMAP diet because, like I said, during that initiation or elimination phase of 4 to 6 weeks, the amount of calories and the food options are more restricted. And so, if you already start at a lower weight, you run the risk of having the diet become actually dangerous for you for that amount of time, which is why it's so important to speak to a doctor, but also have a dietitian look at your weight and be able to evaluate whether you are a good candidate.
So you said 4 to 6 weeks. What happens to somebody if they're on it for quite a few months and they're still working with a dietitian?
So what happens when you take away high FODMAP foods from the diet for too long? What happens is that the gut microbiome changes in negative ways. There is a time in one's life when the gut microbiome has a whole lot of diversity and many different types of bacterial cultures. And those are the times when you can tolerate a lot of foods without many symptoms. A lot of individuals have that experience. With age, with taking antibiotics, having infections, for example, the diversity of that microbiome decreases. And so this is a sort of the core issue with the development of and the onset of irritable bowel syndrome. It's essentially dysbiosis. And so when we take the high FODMAP foods, which tend to be substrate for the healthy bacteria in your microbiome, and you take them away for too long, they tend to not be able to recover and thrive. So you can actually develop more of those symptoms that you're trying to get rid of. more of the bloating, more of the constipation. So things don't really get better. So this is why it's super important to be able to reintroduce, even in small amounts, high FODMAP foods back into the diet to restore the bacterial culture, the healthy bacteria in the microbiome.
This is really important information that you're giving us because a lot of people like to do it yourself. They'll Google it and figure that they'll be fine. I'm glad that we're having this discussion because there are a lot of people who are suffering right now. So please don't go away. We'll be right back with more low FODMAP and how it works. Welcome back to Empowered. I'm Elizabeth Naumovski. Today's episode, we're discussing the low FODMAP diet and what you need to know. So, Alexandra, how does it work?
So the process of the low FODMAP diet starts with an elimination phase, which lasts, like I said, between 4 to 6 weeks. Everyone is at an individual case. Sometimes we tend to go at most 8 weeks, but no longer than that. Sometimes even shorter than that. 2 weeks is the most we will do an elimination phase. And during that phase, we eliminate, like I said, the high FODMAP foods. Once that's done, and we can sort of start with a clean slate, we initiate a reintroduction protocol, which is a very specific and very progressively slow introduction of high FODMAP foods from different categories of fermentable carbohydrates to start to evaluate how your digestive system reacts to them. So there's a monitoring stage for every food challenge that you have. You progressively increase from day 1 to day 3 the amount that you introduce every day. You monitor your symptoms, and then you go through about 12 challenges of food that tend to represent different categories of FODMAPs. At the end of that process, so that process probably lasts around, again, about 6 weeks or so. At the end of that process, you pull all that information together and you come up with what's called a maintenance diet. So with a maintenance diet, what we're able to do is ascertain what types of high FODMAPs one is able to tolerate with large quantities without any symptoms at all, and which high FODMAP foods we're able to have either in smaller quantities or with a lesser frequency, consumed, say, every once or every 3 days or so, to ensure that we don't give the digestive system those quick carbohydrates that it cannot digest very well.
So, once somebody has gone through the assessment, then
Yes.
they've gone through the reintroduction protocol.
Mm-hmm.
What's next after the low FODMAP diet? How do you function then?
So once you go through the process, you're able to accommodate, like I said, start your maintenance diet in being able to reintroduce some high FODMAP foods back into your diet and diversify your food choices. So that may mean, you find out you're not actually lactose intolerant, that you can tolerate the challenged foods that we use for lactose, and you're able to consume dairy products. Or, for example, you are able to tolerate sorbitol, which is a sugar alcohol, and that ensure that you can have more fruits and vegetables from the high FODMAP category. Beyond food, and again, irritable bowel is a syndrome. So, as a syndrome, it means that it has multiple triggers, and food is just one of them. So, beyond food, what we look at is how do you handle stress and whether that communication between the gut and the brain, so the vagus nerve, is happening at a reasonable rate. If it's the digestive system is being hijacked by what the brain is saying, and whether we can reestablish that communication between the gut and the brain. How you sleep affects your digestive system. Whether you are, in a high stressful situation or not, affects not just the mechanics and how the digestive system works, but it can also impact the microbiome. So even beyond the low FODMAP process, and once you achieve a maintenance diet, we have to work on reestablishing the gut microbiome and enhancing the gut microbiome to ensure that it achieves that diversity so that later on we can challenge more foods and hopefully you can you are able to tolerate a larger variety of high FODMAP foods.
So, what happens if it doesn't work?
If it doesn't work, then what we need to look at is obviously your gut microbiome is fine, and the fermentability of food is not is the cause of your symptoms. And so we have to look again beyond food at things like how you handle stressful situations. If there are other, we need to probably go back to the gastroenterologist to ensure that we haven't missed anything, that there are other things that we can investigate. As far as mental health, there is actually a program called NERVA, and it looks at reestablishing, it's a gut-induced hypnotherapy. It looks at reestablishing the conversation between the gut and the brain, so that calms things down when it comes to that conversation and those symptoms that are bothersome.
So, when we come back from the commercial break, we're going to talk a little bit more about that because I find this fascinating. So, please don't go away. We'll be right back. Welcome back to Empowered. I'm Elizabeth Naumovski. I'm joined by Alexandra Anca, founder of Alexandra Anca Nutrition Consulting. She's a dietitian specializing in gastrointestinal disorders, and we're discussing the low FODMAP diet. Alexandra, before we went to break, we were talking about mental health. Could you please expand on that?
Absolutely. So the gut and the brain are connected through what's called the vagus nerve, and it's a two-way communication highway. You have the gut influencing what the microbiology of the gut communicating and sending elements to the brain, which can affect brain function, and also the other way around, what you think and how you handle stress and anxiety can also impact the microbiome. The microbiome is what it is, really. It's just a collection. There's 9 trillion bacterial cultures in your intestine that help break down the food and whatever is not being digested in the small intestine, mostly fibers. And in that process, there are metabolites that are produced by that fermentation, which hopefully does not create a lot of gas and bloating. But there's metabolites that are sent back to the brain, and it helps to maintain a balance in the mental health sphere. And it influences behavior, it influences how we think. And back and forth, that communication needs to be leveled. Otherwise, the microbiome will change. It will change not just from the anxiety or the high stress situation that we live in every day, but also, like I mentioned, the quality of sleep that you have, how well you take care of yourself, physical activity. The microbiome is something that is constantly changing, and it's affected by every meal you have, by where you travel, for example, during travel times to different countries. Your microbiome responds to the environment. And so the combination of mental health, anxiety, how one handles stress, but also how one takes care of oneself affect how well your digestive system processes food and how varied the microbiome is at the end of the day, how it helps us digest foods in general.
It just sounds like such a complicated machine. And we're just scratching the surface here. Like there's so much more to it. I want to ask you about irritable bowel syndrome, IBS. Is the low FODMAP diet the only therapy for this, or is there something else?
As I mentioned, the low FODMAP diet is one of the many therapies we have to manage irritable bowel syndrome. As I mentioned before, a program such as gut-directed hypnotherapy like NERVA is also something that can be helpful. If the dietitian that you're working with is in touch with and communicates with the family physician or the gastroenterologist, the doctor can help in finding other medication methodologies that can help to lessen symptoms. So, for example, we're looking at fiber supplements, we're looking at probiotics, we are looking at a medication that helps with motility. Again, um, mental health affects not just the microbiome, but also the mechanics of the digestive system. This is a story of, an individual who has to go into a very stressful presentation, for example. Some of us experience digestive system symptoms prior to that. And again, it's that communication between the gut and the brain that if it's not helped by diet, it can be helped by medication or other natural supplements that can help alleviate symptoms.
So we have about 20 seconds left. Any words of wisdom for anybody who's suffering, who has anything that they're suffering with right now?
As I said, I think that it's very important to use the low FODMAP diet as a tool and only one tool in the toolbox that we have to handle irritable bowel syndrome. It's a short term diet. It's there to help you navigate the food triggers that you may have, but there are so many other modalities in which we can handle irritable bowel syndrome and help individuals get better.
Thank you so much.
You're so welcome. Thank you.
When it comes to the low FODMAP diet, Alexandra says do not follow the low FODMAP diet for longer than 6 to 8 weeks. It'll negatively impact the diversity of your gut bacteria and will slow down your recovery. Diet is only one of the many therapies that need to be trialed to isolate and treat your sensitive digestive system. Make sure you consult with a well-trained health professional. I'm Elizabeth Naumovski, and I'm here to empower you and make frugality fashionable. Thank you for watching. Bye for now.